The number of New Zealanders diagnosed with cancer each year is set to skyrocket by 50% in the next 2 decades. Yet the system meant to diagnose and treat those patients is already overstretched. The latest State of Cancer report shows Maori remain 1.6 times more likely to die from the disease than other groups, despite efforts to close the gap. Senior reporter Juliet Speedy has the story.
Our overloaded health system is about to get worse as cancer numbers are set to explode.
We know that just because of aging, we're going to see an increase from 30,000 people diagnosed this year to 45,000 in 15 to 20 years. And those numbers are going to be very challenging for us to respond to.
The State of Cancer report shows for Maori and Pacifica populations, cancer is striking harder and killing earlier. Maori were around 1.6 times more likely, and Pacifica 1.4 times more likely to die from cancer than other ethnicities.
That gap, is we see it in screening, where Maori are less likely to participate in screening for bowel, cervical and breast cancer, and the same thing with Pacific peoples.
Also more likely to be diagnosed at ED, and it's the system at fault, not the people. Up to half of all cancers in New Zealand are preventable. That's around 14,000 Kiwis every year who might not have to face this disease at all. But obesity, alcohol harm and poor nutrition are all getting worse. And the report says unless we tackle those issues head on, the numbers will keep rising.
Investment in prevention provides big returns, and that's how we're going to be able to reduce the number of cancer cases being diagnosed in the future.
And if you live in Australia, you will have far better outcomes.
We do quite a bit of benchmarking against international peer countries, and Australia actually has the best outcomes, has better survival outcomes than Canada, the UK, Ireland, Norway, Denmark and New Zealand.
There is some good news.
The first piece of good news is that the chance of dying from cancer has been going down. It's gone down by 25% over the last 20 years, which is great. That's good news. And one of the things driving that is improvements in screening and treatment.
We've massively increased the amount of funding, 604 million extra, dozens of extra cancer drugs, hundreds of thousands of people getting treatments that weren't available 2 years ago. I'm changing the way that Pharmac applies for funding so that if Pharmac can actually save the government money elsewhere, then they can get extra funding.
But the report calls for radical change from who delivers treatment to how fast patients can access it.
The worst case scenario is that we are not ready to deal with what we know is coming.
Because at the moment, cancer is moving faster than we are.